Hey everyone, welcome back. Make sure to like, share, and subscribe to Decode Healthcare with Harshal. Today, we're jumping straight into part 2 of our CPC exam series, and we are laser focused on decoding medical terminology. Seriously, if you've ever felt completely overwhelmed by the sheer volume of clinical words out there, this explainer is exactly what you need.
I mean, are you tired of trying to memorize thousands of medical terms by rote? It's exhausting, right? The thing is, in medical coding and documentation, understanding this language really matters because it drastically reduces ambiguity in medical records. So instead of trying to memorize an entire dictionary, I want you to think of medical terms as predictable Lego blocks. Just one single term can tell you exactly where a condition is located, what's happening to the patient, and just how severe it is.
So the absolutely crucial point here is that medical terminology is basically a standardized language built from predictable building blocks. Once you master these 3 core word parts, that is the secret to turning yourself from a frustrated memorizer into a highly efficient translator. Okay, so here are the 3 core blocks we need to talk about. First up, the prefix at the very beginning. Think of this as a clinical adjective for quantity or location, like hyper for high. Second is the word root, right in the middle, giving us the central meaning, which is usually a body part, like cardi for heart. And third, the suffix at the end. That tells us the condition or procedure, like itis for inflammation. Oh, and notice that O in cardi/O? That is a combining vowel. Its main job is literally just to connect the root to a suffix, so we can actually pronounce the word without stumbling.
And that brings us to the 5-step CPC fast decoding workflow. Guys, this is your ultimate hack for exam prep. When you see a massive, complex clinical word, you do not panic. Instead, you're going to follow this exact logic to break it down super quickly during your test.
Let's walk through these steps. A great trick here is to think of it kind of like reading from right to left. Step 1, start at the end with the suffix to figure out what category of thing is even happening. Step 2, identify the root so you know exactly what body structure is involved. Step 3, add the prefix from the beginning to find out how many, where, or how severe it is. Step 4, rebuild the whole thing in plain English. And finally, Step 5, validate that your translation actually makes clinical sense. Section 1. High-yield numerical prefixes, counting the code. So these prefixes are all about signaling how many or how much. Mono and uni mean 1, bi is 2, like bilateral. Tri and quadri are 3 and 4, pretty straightforward, right? But pay really close attention to poly, which means many or excessive, and oligo, which means few or deficient. Just imagine a patient with kidney failure. Coding for polyuria, which is excessive urine, versus oliguria, which is low urine output, completely changes the clinical picture and obviously the resulting codes. You've got to tie these back to the root for accurate coding.
Moving right along to Section 2, high-yield descriptive prefixes, the opposites.
Now, descriptive prefixes describe intensity, speed, or abnormality. And you'll see these popping up in vital signs all the time. Let's look at our first matchup, hyper versus hypo. Hyper means over or increased, while hypo means under or decreased. This perfectly illustrates how just a single prefix completely flips clinical severity. Think about hypertension versus hypotension. High blood pressure versus low blood pressure. If you get these reversed in your head, you're going to pull the wrong diagnosis code every single time.
Then we've got tachy versus Brady. Tachy means fast and Brady means slow. Just picture the difference in coding an ER visit for a dangerously racing heart, tachycardia, versus a really sluggish slow one, which is bradycardia. The clinical urgency there is entirely different.
And finally, dis versus eu. Eu means good or normal, like a euthyroid patient. But listen up, here's a massive pro tip for your exam. Dis is a really broad term. It means difficult, abnormal, or impaired. Do not just assume it always means painful. For example, dysphagia means difficulty swallowing, but it doesn't necessarily mean that it actually hurts.
All right, Section 3. The decoder's cheat sheet.
I promised you a big payoff for mastering all of this, and well, here it is, your cheat sheet. This perfectly illustrates how the prefixes and suffixes we just went over snap right onto those word roots. You've got your modifiers like hyper and tachy on top, and your conditions and procedures like itis and ectomy on the bottom. If you keep this mental map handy, you will not have to memorize every single clinical word you encounter. It's a total game changer.
And that wraps up our deep dive for today's explainer. Coming up in Part 3, we're going to conquer positional and negative prefixes, plus those essential suffixes you absolutely need to know.
Remember, make sure to like, share, and subscribe to Decode Healthcare with Harshal so you don't miss it. But before we go, I'll leave you with this. Now that you know how to efficiently translate rather than exhaustingly memorize, just how much time and anxiety is this fast decoding method going to save you on exam day? See you next time.